starts with it.
Good morning, everyone. The time having arrived, I'll welcome you to the Tuesday, May 21st, 2013 Board of Supervisors meeting. We will begin by a flag salute led by the 5th District Supervisor, Supervisor Montgomery.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Will the clerk please read the statement of meeting procedures?
Welcome to the Placer County Board of Supervisors meeting of May 21st, 2013. Agendas are available on the wall outside this meeting room. If you are here to speak on an issue not appearing on the agenda, you may do so during the public comment period. There's a 3-minute time limit per speaker. The board is not permitted to take action on items addressed under public comment. When you speak, clearly state your name and address for the record. All items on the agenda will be open for the public to address before final action is taken. There's a 3-minute time limit per speaker, which will be monitored by a timer on the podium. If there is a person speaking on behalf of a group with no other testimony from another member of the group, please identify yourself as such, and your time may be extended at the pleasure of the board. Keep in mind that the chairman has discretion of limiting the total discussion time on any item. If you are hearing impaired, we have listening devices available. It is requested that all pagers and cell phones be either turned off or put in the silent mode. Thank you for your participation and cooperation.
Thank you, Ms. Holman. Now is the time for public comment. Is there anyone in the audience that wishes to address the board on any item that is not on the agenda? Please step forward. Captain Harris, or Chief Harris.
Well, good morning, Mr. Chairman, members of the board. Normally, before we declare fire season, as I've done in years past, I like to go around to the individual board members and talk about what our upcoming fire season is going to entail, when we want to start, and all the things that go with the planning and preparation. This year's been a little bit different for us. We declared fire season on May 1st, which is a historic event for us. We've never declared fire season as early as we've done this year. Generally, we phase in the hiring of our seasonal firefighters to bring our forces to full staff somewhere around the middle of June. This year, over the course of 48 hours, we had to hire all of our seasonal firefighters and bring ourselves up to full staffing, or as close to full staffing as we could get, hiring people that quickly. Currently, all of our CAL FIRE stations in the Nevada Yuba Placer unit are staffed, and most of our second engines are staffed, just to give you an idea of how far ahead we are in the things that we've been looking at this year. Some of the things we're looking at, again, we've talked about it in the past. I'm not going to predict the worst fire season in history. I've long ago learned not to do that. But looking at the indicators that we have out there right now, the energy release components, the things that is a indicator of the amount of energy that a fire releases when it's burning, intensity of the fire, for lack of a better term. Right now, those indices are off the chart. They are well above where we would normally be at the height of fire season in July, and we've just barely started with the number of wind events that we've had over the last few weeks. Our fuel moistures, the larger fuels, are off the bottom of the chart. They're already below where we should be in August. So we're not looking at conditions that are going to be favorable to us this year. And we're going to do a number of things in preparation for that. Not only are we going to staff early, but we're going to have to look seriously when we ban burning. Normally we start the annual ban on burning somewhere around July 1st. I don't know that we're going to make July 1st this year. We're looking at the conditions that are out there right now. I want to keep it open as long as I can, so that it gives us every tool in the toolbox to go out there and allow the public to get rid of the fuels that are around their property. But we've already had to shut burning down because of burning conditions on a number of occasions already. And I don't think we're going to make July 1st. We're going to do everything we can to make July 1st, but it's not looking good at this point. So anyways, it should be Interesting fire season for us this year, working closely with all of our cooperators, both in local government and in the federal government, to ensure that we're doing everything to contain our fires as small as we can and as quickly as we can. And we'll continue to work to those ends throughout this fire season. And as things start to develop, I'll be sure to be in contact with the board. So I'd be happy to answer any questions that the board may have.
Questions for Chief Harris? See none. Thank you so much for the update.
Thank you.
Keep us posted. Thank you. Anyone else wish to address the board under public comment? Seeing none, we will move on to supervisor committee reports. Any reports from any supervisors? Oh, Supervisor Montgomery.
Yeah, I have the, this is not actually a committee report, and I'm very sorry to have to report this, but I wanted to let folks know that Officer Todd Ketwig from the Gold Run CHP passed away yesterday morning after a very long battle with cancer. He leaves behind a wife and children. At this point, there's not a memorial service or a funeral that's scheduled, but as soon as we get that information, we'll try to get it out to everyone. He was wonderful individual, much loved by the members of the municipal advisory councils who got to hear his reports, and was a terrific, terrific individual to work with from the county's perspective. And he'll be missed very deeply by all of us.
Thank you. Any other? Seeing none, we'll move to the consent agenda. Any items on the consent agenda any board member wishes to pull for discussion? Anyone in the audience that's present, are there any consent items they wish to pull for discussion? Seeing none?
Second.
It's been moved and seconded to approve the consent agenda. Will the clerk please call the roll?
Euler, Wygant, Montgomery,
Yes.
Holmes.
Yes. For the record, Supervisor Duran has been delayed. He will be here as soon as he can, just to let you know. Let's see, what do we got here? I think we'll squeeze in facility service. We got a couple of minutes before our 9:10. Award of bid job ordering contract. Morning.
Good morning, Chairman Holmes, members of the board. Rob Unholz with Capital Improvements. I'm the Program Manager for Capital Projects Division. With me is Doug Hawk, Senior Architect with Facility Services.
Okay.
The item before your board is a recommendation to award the bid to both CPAC Engineering Incorporated and Fregoso Builders Incorporated, respectively, in an amount not to exceed $1 million each. And upon approval by County Council and Risk Management, authorize the Director of Facility Services or his designee to execute the contracts funded by current and future capital projects with no additional net county cost. And approve a resolution authorizing the Director of Facility Services or his designee to execute job order contracts in amounts not to exceed $250,000 and delegating authority to approve any supplemental job orders consistent with county purchasing policy and Section 20142 of the Public Contract Code. In April of 2010, your board approved a contract for job order contracting, or JOC as we refer to it, with the Gordian Group of Malden, South Carolina. The Gordian Group has worked with Facility Services to develop an integrated JOC system, including document development, procurement support, computer software, and training over the past 2 years. Job order contracts provide indefinite quantity contracts by which contractors will perform a variety of specific construction tasks at different locations. The scope includes general construction, repair, and remodel, and other related repetitive work to be performed under the management of Department of Facility Services. A series of construction tasks with preset unit prices were established and published by the county as a construction Task Catalog, or the CTC. The CTC was developed by the Gordian Group, assuming the use of experienced local labor and high-quality materials. All unit prices are based on local labor at prevailing wages, material, and equipment. On March 26th, your board approved plans and specs and authorized staff to solicit bids for JOC. The bid solicitation was advertised in accordance with the Public Contract Code. Documents were sent to 8 trade contractors and 8 building exchanges. Bids were open on April 25th, resulting in 6 bids. The 2 apparent responsive and responsible low bidders were CPAC Engineering and Fregoso Builders. Bids included adjustment factors to account for work east and west of Donner Summit within secured facilities and for work performed during normal and non-normal business hours. An individual project is priced based on multiplying the applicable preset unit costs and the quantities by the adjustment factor. The minimum contract value is $50,000 for each contractor. Each contractor will receive aggregate job orders totaling at least $50,000 during the contract term. The estimated total value of each contract is $1 million. And the county reserves the right to increase the maximum value to that value currently established in the Public Contract Code. Upon approval of these contracts and when the need for services arises, a detailed scope will be issued to the contractors. The contractor will then develop a price proposal for review, and a job order will be issued if the proposal is found to be reasonable and acceptable. Facility Services recommends that your board authorize the director to execute job orders up to $250,000 for approved funded projects and maintenance work. Staff will return to your board for authorization of job orders not meeting these criteria. In order to proceed with the job order contracting project, it's requested that your board approve the bid pursuant to the county purchasing policy manual. The project is exempt from review pursuant to CEQA guidelines, section 15301, and the estimated total cost of job orders under this contract is $2 million. There are sufficient funds appropriated in the respective capital project accounts and maintenance budgets for these services. Be happy to answer any questions and recommend your approval.
Any questions from board members? Seeing none, is there anyone present that wishes to address this issue? Seeing none, I'll bring it back for action. It's been moved and seconded to approve item 8, Facility Services. All those in favor, please say aye.
Aye.
Aye. Any opposed? Any abstentions? Seeing none? Thank you.
Thank you.
The motion is approved. It is now my pleasure to present a commendation to Jerry Brentnall for his service on the Placer County Planning Commission. Jerry, would you please step up to the lectern while I embarrass you and read this? In the matter of a commendation honoring Jerry Brentnall, whereas Jerry Brentnall served as Placer County Planning Commissioner for 16 years, whereas Jerry served as Commission Chairman in 2000, 2006, and 2010, whereas Jerry was the Planning Commission's appointed member on the Placer County Solid Waste Task Force for 16 years, and whereas Jerry imparted his vast legal knowledge and background to the Commission in a courteous and professional manner, and whereas Jerry has steadfastly served with enthusiasm, commitment, and a robust sense of humor in many long and contentious hearings that would try the patience of a saint. And whereas Jerry is known for having an eye for protecting the integrity of the hearing process for all participants. And whereas Jerry has worked tirelessly to protect and plan for a cohesive trail system through the county, and whereas Jerry asserted strong community values and provided astute and creative suggestions to many thorny issues facing the Commission over the years. And whereas during his tenure as Planning Commissioner, Jerry has participated in such projects and decisions as the Bill Graham Presents Sound Test, the Los Lagos Project, and the battle to save the Valley Elderberry Longhorn Beetle, the Forest Hill and Granite Bay Community Plans, the 3 Gs, General Plan Amendments, golf courses, and gates. Plans, and more plans. To be specific, the Bickford Ranch, Placer Vineyards, Riola Vineyards specific plans. Whereas Jerry has helped influence the pattern and appearance of the development in Placer County through his contribution to the Planning Commission decisions in the implementation of the county's community plans and his participation in the development of numerous amendments to the county's zoning ordinance. And whereas, in addition to his tireless service to the Placer County Planning Commission, Jerry has never lost sight of his main focus in life as a dedicated father, grandfather, and husband. Now therefore let it be known, the Placer County Board of Supervisors hereby commends Gerald Brittenall on his 16 years of dedicated service to the citizens of Placer County as a planning commissioner and sincerely wishes him all the best. Congratulations.
A few words. So, Chairman Holmes, supervisors, I'm quite honored to receive this recognition, and when I consider the list of those who have preceded me, I'm quite humbled. You listed some of those items that we grappled with on the Planning Commission, and they were quite a lot of fun. Many, many hours of hearing, as you probably well know, since most of those managed to bubble their way up here in one form or another before going to the courts. The only one you didn't mention was Happy the Mule. I don't know if you remember Happy the Mule. That's a discussion sometime over a drink or cup of coffee, I suppose. I've learned a lot, and I've had a great time. Did a lot of work. I'd like to thank the staff, Michael Johnson at the moment, Fred Yeager, his predecessor, for being so kind and gentle to me and guiding along the Greenhorn Planning Commissioner as I was. I've learned a lot. My vocabulary has expanded, as I'm sure yours has too. Levels of service. My favorite being that introduced to me by Stephanie Holloway. We were having a discussion one day over some traffic issue in a project, and she said, well, we can put in some traffic calming devices. And I asked, well, what's that? Oh, you know, stop signs, yield signs, speed bumps, traffic circles. So I've learned a lot since I've been here. I've been raised to believe that a citizen owes a duty to their community or their country to serve in one form or another. And I thank you and your predecessors for allowing me this opportunity. Thank you.
Thank you, Gerald. Thank you very much. Alrighty, let's see. I think we'll move on to the 9:15 timed item. Board of Supervisors commendation presented by Supervisor Montgomery for Michael Goodwin for his contribution to the Auburn Symphony.
Thank you. And if I can ask Joanne Valentine to come forward. Joanne is the president of the Auburn Symphony Board, and I'm delighted that she could make it here today because she's a very, very busy woman. But I'm also extremely pleased that we have other board members, staff, and musicians from the symphony here today, and it's just wonderful that so many folks could actually make it to a daytime meeting. So thank you particularly for coming. I'm going to read this and then give you some opportunities to make any comments that you would like to make, and we'll take a couple of photos. So this is a commendation from the County of Placer Board of Supervisors in the matter of a commendation honoring Maestro Michael Goodwin for his contribution to the Auburn Symphony and the arts of Placer County as the heart and soul of the Auburn Symphony for over 17 years. Whereas Michael Goodwin was born in London in 1946, His long music career began at the age of 6 when he began piano lessons, followed by flute and cello. He earned a Bachelor of Arts degree in music at Leeds University and a master's degree in music with distinction at California State University, Chico. He studied conducting at the Guildhall School of Music in London, the Mozarteum Summer Academy, and the London Opera Centre, where he was also trained as an opera pianist and coach. Goodwin's career led him to Australia and Iran, where he conducted numerous orchestras, and eventually to California in 1981, where he worked to build the Apollo Orchestra and Chorus, which he continued to direct until his death. And whereas Michael Goodwin was the Auburn Symphony's music director for 17 of the orchestra's 25-year history, during this time the symphony not only survived, it thrived. With Michael Goodwin's guidance, the orchestra doubled in size to its current embodiment of 75 musicians, attracting professional-level musicians from throughout the Northern California region. And whereas Auburn is one of the few communities of its size to have a fully developed symphonic orchestra with a masterworks program, including an engagement at the prestigious Mondavi Center for the Performing Arts in Davis, and whereas Michael transformed the Auburn Symphony from a local amateur orchestra to a regional orchestra with a reputation of performing extremely high-quality classical music, and whereas during Michael's tenure, the orchestra's many programs were implemented that benefited the community, including the Auburn Symphony's educational outreach program that takes the symphony to the schools and preschools in the area. This program reaches more than 6,000 students each year. And whereas the symphony's outreach plays a vital role in educating our youth and introducing them to the musical concepts that play a vital role in cognitive development in later years, and whereas Michael Goodwin was also instrumental in creating the Auburn Symphony's Youth Artist Competition, which each year recognizes the top instrumental musicians ages 8 to 20 years old in the Tri-County area of Placer, Nevada, and El Dorado counties. And whereas on March 25th, 2013, the City of Auburn approved a tile to be installed in the city's Arts District in recognition of Maestro Goodwin's contributions to the rich history of the City of Auburn. Now, therefore let it be known that Maestro Michael Goodwin's baton is at rest, and he will always be remembered for his contribution to Auburn, Placer County, and the world of music. The maestro is quoted as saying, "The music must live on." I'm delighted to present this to you today, Joanne. Thank you.
Thank you so much. Could we have one of the founding members here?
Please.
We have some board members here. Would you please come up?
Come on, everybody.
Come on.
Come on, Auburn.
We have a great symphony.
Chairman Holmes, would you come join us as well, please? Sure. We like to spring these surprises on you, too.
Well, I always like to have a photo with a bunch of pretty ladies.
Kind of do that. You're like me, not the world's tallest human being. Come on, everybody in here.
Get everybody.
Squeeze in.
Sue, can I get in front of you, Sue?
Thank you, and whoever would like to speak, please do. Don't feel shy.
Okay. Don't just. Thank you so very much. I'd especially like to thank Supervisor Montgomery and Supervisor Holmes for their continual support for the symphony. As you can tell, the symphony was more than Michael. Michael was the nucleus, but look what he's attracted. We have an incredible group of people who continue to bring the symphony to Placer County because we are the only symphony in Placer County. This little tiny town of Auburn gives to Placer County one of the most incredible symphonic orchestras around. I'd like to thank particularly Jennifer Keck, who's one of the founding members, Jennifer, thank you. We have our second vice president and first vice president, Audrey Mueller, who has been an amazing person as far as bringing Symphony Goes to school. Our first vice president, Liz Briggs, who does Symphony in the Park. Plus, not only do we have these people, we have two people in our office, Rob Haswell and Jennifer Saunders, who keep us on an even keel and keep things moving along. So they are instrumental also in making sure that the orchestra continues at the wonderful pace that we're continuing. We have a new director, Peter Jaffe. If you have not attended the symphony, you must. That's all I can say is you must, because there is an experience there that is mind-boggling. You will not believe you're in a little tiny town of less than 15,000 people with an orchestra the same quality that you'd find in San Francisco. And you don't have to drive so far. So do come and see us, and thank you all. Thank the board members, thank our wonderful orchestra, and thank the wonderful support that the orchestra has. Thank you.
And where are your the most...
At the high school, not too far. You don't have to drive very far.
Placer High School, right?
Placer High School,
All right.
absolutely, Placer High School, the auditorium. And usually when we have the Masterwork series, it's on Friday or Saturday night and Sunday afternoon. So if you don't want to drive at night, come Sunday afternoon.
All right.
It'll be an experience that you'll be really glad you did. Thank you so much.
And Joanne, before you leave, what's happening on June 11th?
June 11th, we are going to, thank you. We are going to have a wonderful event at the State Theater honoring Michael and the wonderful stone in front. So please do call the office and do come to the event. It will be at 5 o'clock in the afternoon on June 11th at the State Theater. You're all invited, and I know you'll have a wonderful time because there's going to be a movie showing the history and a lot of the people that have made the orchestra grow to the point it's at now. And there'll be refreshments, and of course you'll get a chance to listen to Maestro Jaffe. So please put that on your calendar. Thank you, Jennifer. And thank you, Rob, and everybody else who has helped make this whole thing happen. Thank you,
Thank you.
Supervisor Holmes, and particularly Supervisor Montgomery.
Okay, thank you very much. We'll now move to our department item 8B, Sheridan Water Supply Improvements Project. Mr. Bell.
Good morning, Chairman Holmes, members of your board. I'm Kevin Bell. I'm the Environmental Engineering Program Manager and Facility Services. I'm here this morning to request your board adopt two resolutions authorizing the Director of Facility Services or designee to first award the bid for construction for the Sheridan Water Supply Improvements Project to Westcon Construction Corporation in the amount of $1,513,817,000, contingent upon a funding commitment of $700,000 from the U.S. Department of Agriculture Rural Utility Service, or RUS. And second, to execute a contract with Westcon Construction Corporation and any required change orders consistent with the County Purchasing Manual and Section 20142 of the Public Contract Code for a total amount not to exceed $1,605,000 upon approval of County Council and Risk Management, funded by budgeted capital project funding and the anticipated RUS grant funds. The Sheridan Water Supply Project includes construction of a new well, a new storage tank, 180,000 gallons, and a pump station near the Sheridan Park behind Stewart Hall, as well as distribution piping to the Sheridan Elementary School. Completion of the project will bring the water system into compliance with the California Water Works standards, provide fire flow to the school, and in conjunction with the sewer improvements that have been supported by your board over the last several years, provide for an additional 100 to 200 new connections in the community. Funding for the project is made up of a housing, urban development, community development block grant of $454,600, a previous general fund contributions totaling $456,800, a previously approved loan from the Solid Waste Management Enterprise Fund of $925,000, and the pending $700,000 RUS grant. On December 11th, 2012, your board approved the plans and specifications for the project, authorized staff to solicit bids, and adopted the mitigated negative declaration and mitigation monitoring and reporting program for the project. Staff began advertising for the bids on December 31st, 2012, and bids were opened on February 13th, 2013. We received a total of 13 bids, so we had a lot of interest in the project. And Westcon was the lowest responsive bidder with a bid amount of $1,513,817. The engineer's estimate for the project is $1,488,000. Staff has secured all the funding for the project with the exception of the RUS grant. The county's grant application for the RUS grant has been approved by RUS staff. However, RUS has not received their annual funding contribution yet. We anticipate that will happen this week. They've told us that it will happen this week. And so the bids expire on June 3rd, 2013, which is prior to the next board meeting. And so we're asking today for your board to authorize the Director of Facility Services to award the bid and execute the resulting construction contract contingent on the RUS grant funding commitment. And with that, I'm happy to answer any questions that your board has.
Thank you. Any questions from board members? Seeing none, any members of those present wish to address the board on this item? Seeing none, we'll bring it back for action.
Move approval, and thanks to staff for all the work and energy that went into this. Appreciate it.
Second to what he said.
It's moved and seconded to approve Department Item 8B, Sheridan Water Supply Improvements Project 04834. All those in favor, please say aye. Aye. Any opposed? Any abstentions? Thank you. We'll now move to our 9:30 timed item, Facility Services, the Granite Bay Parks, Trails, and Open Space Assessment District. Mr. Rideout.
Morning, Mr. Chairman, members of the board. Mark Rideout, Facility Services. The actions that we're requesting today relating to this item are to conduct a public hearing, which will consider adoption of a resolution, and that's approving the engineer's report, is confirming the diagram and assessment, and ordering the levy of the assessment for fiscal year 2013-14, and this is for the Granite Bay Parks, Trails, and Open Space Assessment District, and there's no net county cost associated with this action. This is the third annual trip that we make to your board to levy this assessment. This relates to the 2001 voter approval of funding for approximately 8 parks, 30 miles of multi-use trails, and 20 miles of bike trails in this region of Granite Bay. There are about 8,000 single-family dwelling equivalents that pay into this assessment district. Back in January of this year, we were at your board and named SCI Consulting Group of Fairfield as the engineer of record. Through their studies and evaluation of this assessment, they've identified a 2.24% consumer price index, which equates to approximately $1.60 per benefit assessment unit, and that'll bring the assessment to $72.92 for the coming fiscal year. All of that will result in approximately $581,099 brought into the assessment district to fund these this work. And really we're maintaining, we're conducting improvements, and we're administering this great public amenity we have there. So with that briefly, I can answer any questions you have. We have Susan Barnes of SCI in the audience if you have questions of her as well.
Any questions from board members? Seeing none, anyone present wish to address this item? Seeing none, we'll bring it back to the board. Oh, you were conducting a public hearing. Oh, yeah, this is a public hearing, by the way. The public hearing is open, and now the public hearing is closed. It's been moved and seconded to approve item 3, Facility Service, Granite Bay Parks, Trails, and Open Space Assessment District. All those in favor, please say aye. Aye. Any opposed? Any abstentions? Hearing none? Thank you. I saw, recognized her. 9:40 now. We'll move to Department Item 9, Health and Human Services, Administrative Services, Super Resolution. Wow, sounds like we're in Congress. Ms. Baumann.
Good morning, Mr. Chairman, members of the board. Maureen Baumann with the Adult System of Care. Richard Knecht with the Children's System of Care. This morning, we are excited to bring forward to you 43 contracts meeting specified requirements to assist the Placer County Department of Health and Human Services to effectively partner with agencies in the community in a range of diverse services, including veterinary services, AIDS and HIV counseling, inpatient psychiatric care, medical services, and adoption planning. These contracts are in place in order to provide increased, cost-effective, and efficient services for the many residents of Placer County who receive services in this integrated department. For each program is approved by the CEO, County Council, and Risk Management, and all listed contracts are included in the department's 13-14 requested budget. We're asking you to take 3 actions this morning. 1, to adopt the super resolution authorizing the Director of Health and Human Services to execute the renewals of 43 separate and distinct expenditure agreements. And just a note, these contracts have all been approved previously. It's one of the requirements as independent items by the Board of Supervisors. 2nd, to authorize the Director of Health and Human Services to sign subsequent amendments to increase the initial contract amount by not more than 10%. And lastly, to authorize the Director of Health and Human Services to submit applications, execute revenue contracts, and accept funding amounts under $250,000, as well as to execute non-monetary cooperative agreements with other entities for increased efficiency. I'd just like to note that the department has about 300 contracts that we have in place at any one time, and our contracted amounts of services is in the neighborhood of 40% of our operating budget. In prior years, each contract was submitted to the Board of Supervisors individually, which created really a significant workload for yourselves and for the department and the people in between in terms of County Council, CEO. We've addressed this issue with the single resolution, and it was really established to minimize county workload in this area. All the agreements, as I said, do have oversight from CEO, County Council, and Risk Management, so there is a review process still in place. But we believe that this time-saving arrangement, first approved by your board in 2001, is estimated to save $30,000 in staff time by approving these 43 agreements in one process. So just quickly, the following agreements were used, the following criteria was used to put these in this one super resolution. So they were previously approved, as I said, as a standalone item. They're recurring agreements with less than $250,000. They are all for the 13-14 year budget process, and they do not require a competitive bid process. So we'd just like to highlight a few. We have extensive partnerships with community organizations in our community. So I'll give you a couple of examples. One of these is a psychiatrist who provides over 15 hours of after-hours mental health crisis services annually, who helps the 2,500 people we expect to see this year who are assessed because they are deemed to be either danger to themselves, danger to others, or gravely disabled. He helps them connect with appropriate resources, including involuntary hospitalization, to keep both themselves and the community safe. We have a contract with Mental Health America, who provides peer support for family members of persons with mental illness. These services improve outcomes for persons receiving mental health treatment by engaging the entire family in the recovery process. We're also funding a very successful outpatient substance abuse treatment program on the CSOC side, Full Circle Treatment Program, which is now affiliated with the Community Recovery Resources Organization, where this year we expect 25 youth to be provided a kind of intensive counseling service to address drug and alcohol use. Untreated, these youth would otherwise find themselves in either the child welfare or probation systems. And this program really provides a great personal and taxpayer resource and saves dollars as a result. And lastly, Emmy Housing, organization who does housing for folks with mental illness, has a peer-run transitional house that's supporting 6 adults with mental illness. This new model is establishing peer support counselors to teach groups, share life experiences, help people with job application resources, recovery, and life skills. And we are finding that this model is really effective in terms of helping people stay on the path of recovery with support from their peers. So I'd be happy to answer any questions and would recommend approving the 43 contracts and approving the authority for specified actions.
Supervisor Montgomery.
Richard, Maureen, thank you. I did have one question that's really just a clarification. On the third item that you're asking us to take today, which is authorizing the Director of Health and Human Services to submit applications, execute revenue contracts, and accept grant funding. I wanted to make sure that on the execute revenue contracts, that is just authorization to accept revenue contractually, not to enter into contracts to generate additional revenue through fees or anything along those
Correct,
lines.
accepting revenue specifically.
Perfect. It just wasn't really specified within the document, so thank you.
Yes.
Any other comments from board members? Seeing none, anyone present wish to address the board on this item? Seeing none, we'll bring it back to the board for action.
Move approval.
It's been moved and seconded to approve item 9, Health and Human Services, A, 1, 2, and 3. All those in favor, please say aye. Aye. Any opposed? Any abstentions? Seeing none. I think since you're here, we'll go ahead and move to item 9B, Adult System of Care Mental Health Awareness Month.
Excellent.
Okay.
Thank you.
You're welcome.
So board members, I would now like to request that you promote mental health awareness by proclaiming May as Mental Health Awareness Month in Placer County. We have some items for you that Richard is going to give to you to celebrate May and to help you help us spread the word. So 1 in 4 Americans, 90,000 people in Placer County, live with common and treatable mental health disorders. It's a disease of many, not just a few. This is our disease. Many of us, our residents, are getting help with public and private services and supports. However, we just need to really remember that the stigma of mental illness keeps some people from getting the services they need. This month, we are working to raise awareness about the importance of mental health and wellness. So we have some cups and some bags and some green ribbons, pins. So when you wear your green pin, people will ask you, what does it mean? And you'll have an opportunity, if you choose, to be able to give them some information about that.
It's happened several times today.
Thank you, Supervisor Holmes. So wellness is more than an absence of disease. It's really an essential component of overall health and well-being and is tied to the balance that exists between our emotional, physical, and mental health. Whatever our situations, we are all at risk of stress given the demands of daily life and the challenge it brings to our homework. Steps that build and maintain well-being and help us all achieve wellness include a balanced diet, regular exercise, adequate sleep, development of coping skills that promote resiliency and emotional awareness, and connections to family, friends, and community. We all need to take stock of our well-being through regular mental health checkups and screenings, just like we get our blood pressure checked and get cancer screenings. We think it's a good idea to take stock of our mental health on some sort of a regular basis. So some folks might wonder, what does that mean? I really think it takes a personal review to see what are changing in our lives. So we know what is our normal, and we need to evaluate, are we feeling depressed? Are we feeling anxious? Are we having trouble sleeping? If we're not in our normal range, then we know we should probably check in with somebody. Maybe it's our primary care physician, or maybe it's a mental health specialist. But our whole health is important, and we really shouldn't neglect any of it. So I want to now quickly tell you about some of the actions that are going on in Placer County on the education and awareness on this very important topic. We have been implementing, along with the state, a variety of programs to prevent suicide, to decrease stigma and discrimination, and to promote student mental health. The suicide prevention campaign that we have statewide educates people to increase their knowledge so that they can recognize suicide warnings, know how to talk to people, and identify professional and community resources. So it's an easy webpage, suicideispreventable.org, and it empowers, it's in your board memo, it really empowers people with life-saving tools. So it gives you really specific ideas of what you're listening for with some, an interactive webpage, ideas about what you could say to somebody, which people always want to know. So if I'm worried about somebody, what do I say? And it actually gives you phrases and tells you what's helpful and what's not helpful. And then each county is listed with the resources that are available in that particular county. So it's a great interactive webpage. We also have a great first aid program. We have CPR for physical health issues, and we have mental health first aid a 12-hour program that teaches people what to do if somebody has a mental illness that they're concerned about or if somebody appears to be suicidal. Really hands-on, practical approach. Not training people how to be a professional, but really just like first aid. What do you do as a first responder? How do you interact? How do you get help? And what do you do to keep somebody safe in the interim? So a great class. We have promoted it in Placer County, and in the central region, we have had thousands of people attend this class, and we expect to continue that. It also just gives people, demystifies some of the mental illness. People get, feel like they're not sure what it is, and they don't know about it, and it really demystifies it and gives people a lot of education. Related to that, statewide stigma and discrimination, we have a very, very exciting documentary coming up, Each Mind Matters. It's a web page, and a documentary is going to be aired on the subject. So again, eachmindmatters.org. It's part of the campaign. It's on the T-shirts. It's on the cup. It's a new web page that, again, lots and lots of resources for all of California. We know that stigma and discrimination are part of the reason people don't get help, and so we really feel like we have to address this issue in order to save lives with this, important issue. So we have an event happening on May 30th, which is a week from Thursday. All of the public television stations in California will be airing a new documentary. And it's A New State of Mind, Ending the Stigma of Mental Illness. And it tells the stories of everyday people. I imagine there'll be some footage of Placer. There'll be everyday people. There'll be Daryl Steinberg. It's a 1-hour documentary, 9 o'clock in our area, on our public radio station, KVIE. We're very, very excited about it, and it's just part of the campaign. We know that reducing stigma is really how we're going to get help for people, and we also know that when people hear somebody that has had an experience with mental illness or an experience with suicide, and they understand that person and hear them talk, that is one of the key ways. There's evidence that is really how we reduce stigma and discrimination. So with that, I'd be happy to answer any questions or hear your comments, but I would recommend that you proclaim May as Mental Health Awareness Month in Placer County.
Any comments, questions from board members? I'd like to take this opportunity. The board has received a letter from Jennifer Adams about her service with Kirby Hills, and I just wanted to read it so everybody's aware what kind of program we have. I want to express my extreme pleasure and appreciation for the assistance I received from Placer Health and Human Services. I recently found myself homeless, as well in need of cash assistance, medical coverage, and mental health services, which I received at Kirby Hills, and have been so very pleased with everyone's professionalism, patience, expertise, sense of humor, compassion, and assistance. At no time did I ever feel like just a number or just another faceless, needy person. I've been treated with the utmost respect, courtesy, efficiency, and dignity, which has really helped me in my sudden transition from being a gainfully employed, functioning individual to a jobless, homeless, depressed person in need of major help. The people at Kirby Hills, for my 72-hour hold, CalFresh, Cash Aid, medical coverage, the Effort Clinic, AMIH, Department of Housing, and countless others have been just an absolute godsend. In the span of 2 days, upon having been released from the 72-hour hold, I had CalFresh, Cash Aid, and medical coverage. In 2 more business days, I had secured housing and got moved into my independent residence. I don't know of any government entity agency that functions as efficiently, professionally, and friendly as Placer County. Thank you so very much. You have phenomenal people working for you. Please acknowledge them accordingly for a job very well done. Jennifer Adams. So I think that's a tremendous compliment to our Health and Human Services and our programs for mental health. So just thought I'd enter that into the conversation.
Thank you very much.
Is there any other board members? Anyone present that wishes to address this item? Seeing none, we'll bring it back to the board.
I guess we're looking for a specific action here.
Yeah, we're going to
Proclaim.
Okay, I move that we proclaim May as Mental
Health
Health Awareness Month in Placer County.
Right. It's moved and seconded to approve proclaim May as Mental Health Awareness Month in Placer County. All those in favor, please say aye.
Aye.
Any noes or abstentions? Seeing none, thank you very much. We'll now move to our 9:40 timed item, which is
Good morning, Mr. Chair, members of the board. Jim Durfee,
is ready to go.
one last time as Director of Facility Services.
Yes, I understand.
I'm here today with a recommendation that your board conduct a public hearing and adopt a resolution, confirm the county service area assessment and fee report for fiscal year 2013-14, and that you authorize the collection of assessments on the 2013-14 tax rolls. As your board is aware, since the early 80s, really as a result of Prop 13, the counties required that new subdivisions form county service area zones in order to fund operation and maintenance of various infrastructure and services. Each year, your board is requested to approve this and approve the new assessments and put them onto the tax rolls. These various CSAs include street lighting, road rehabilitation, drainage maintenance, snow removal, any number of different services out in the communities. These CSAs, there's about 160 of them. Some of them include annual inflators if they were built into the original formation of the district as they were approved by the voters. Some of those do not have inflators. The assessments as attached to the item all indicate which CSAs will have essentially a cost of living increase this year and which ones will not. Only those CSAs that have those voter-approved inflators will be adjusted. This item is actually not subject to CEQA. This is simply an annual administrative measure that your board considers and takes. I would recommend that you conduct a public hearing, and Valerie Bain and I are here to answer any questions that you may have.
All right, I will open the public hearing. Any questions, comments from board members? Anyone present wish to address the board on this item? Seeing none, I will close the public hearing and bring it back to the board. What is the pleasure of the board?
Second.
It's been moved and seconded to approve item 4, Facility Services, to approve county service area assessment and fee report for fiscal year 2013-14. All those in favor, please say aye. Aye. Any opposed? Any abstentions? Hearing none, the item is moved.
Thank you.
Thank you. And now we will move back to our department items. Item 9C, Human Services, Affordable Care Act, and other health care coverage changes.
Yes.
Ms. Davis.
Yes. Good morning, Chair Holmes, members of the board. I'm Cheryl Davis from your Human Services Division. With me is Maureen Bauman and Richard Connect from your Adult System of Care and Children's System of Care, as well as Dr. Burton. And we're here today to provide you a briefing on healthcare changes that will be coming in the next few months. And we have a PowerPoint for you. There are 3 significant changes that will be happening. The first one is the Healthy Families transition. Healthy Families is a program for children. It's a health insurance program for children. In the 2012 legislative agenda, the governor proposed and legislature approved, the governor signed, moving the Healthy Families program into Medi-Cal. That began in January 1 with new applicants to Healthy Families being referred to Medi-Cal. We get up to 300 applications a month. We believe by the end of this calendar year we'll have added 3,000 children to Medi-Cal through this program. Healthy Families insures children only who are above the income level for Medi-Cal, but whose parents are up to just about 250% of poverty level, so still struggle to buy health insurance for their children. The big rush for us workload-wise is with the existing beneficiaries. We have over 5,000 children currently receiving Healthy Families in Placer County, about 2,700 families, and they begin transitioning to us in September. They will receive a notice in July 1 from the state. It said it went out, oh, no, it is not there, I'm sorry. It's the notice that was supposed to go out in April. The state is delayed in its implementation, and it will be going out July 1 to all these families. There's a lot of confusion already out there with our healthy families believing that they're going to lose coverage. So we are working on a fact sheet that we will get out to our family resource centers by the end of the week, explaining what's coming, because we do not control these notices. The state controls the notices. The state will provide the information to the families, but we know we will feel the brunt of the questions, and it's information we will share with your offices as you encounter those questions out in the community. Between the 3,000 new children and the 5,000 existing children, we expect to add about 8,000 more children to our Medi-Cal program. Right now, we have 32,000 individuals on Medi-Cal, so we will have a 25% increase in that program by the end of the calendar year. Our second big issue is moving to managed care. Placer County is one of the remaining 28 counties of fee-for-service. When our recipients have their Medi-Cal card, they see a doctor, the doctor bills the state and receives a fee for that incidence of service. Part, again, of the health care reform that's occurring within the state is to move everyone to a health plan. It's more cost-effective, and there's better health outcomes through a managed care plan. So the state did issue an RFP. They chose 2 health plans for the 28 counties, Anthem Blue Cross and California Health and Wellness. Brand new program to California. It's based in Missouri. They actually operate health care coverage in about 14 states. So they are now working up to get the network of providers established. This implementation also is September 1. And so notices will be issued. I'm sorry, I got them confused with the last slide. Notices were supposed to go out April 1. They are delayed. They will go out July 1 to our existing 11,600 households. That's the 32,000 folks I had mentioned sooner. So we will have about 15,000 families between the Healthy Families notices on July 1 and all of our Medi-Cal recipients getting mailings from the state, which we know will cause massive confusion. So we expect to have a very busy summer in our call center, and we'll probably have some rollover for you, Ann, unfortunately. So we'll keep you posted on that. If families do not choose one of the 2 plans, a plan will be selected for them. There's only 2 groups of our Medi-Cal recipients that are not mandated to choose a plan. Senior citizens who also receive Medicare and persons with disabilities who are on SSI. They can remain fee-for-service. What we know is that our individuals who are persons with disabilities will choose more than likely to come onto a managed care plan, but our seniors may want to stick with what they have already. We will be doing a lot of pre-work with our community-based organizations, our faith-based organizations, and getting information out ahead of the curve with the state, again, trying to get as much accurate information out as possible before these huge packets come from the state that are very upsetting, folks. Then, our largest initiative, so we have a very active July, August into September. We get about 30 days to catch our breath in September, and we start with the Affordable Care Act, or open enrollment for the new health care changes. As you know, that takes effect January 1, 2014. The Affordable Care Act required states to set up health insurance exchanges. California did. It's called the Health Benefits Exchange. And that the Health Benefits Exchange set up what's called Covered California. That is the insurance marketplace that they are setting up. Very similar to large employers. Open enrollment periods, certain qualified health plans that beneficiaries will be able to choose from. Folks will apply through Covered California through their call center, online, by mail. But the state has designated human services offices across the state for folks who want to have that face-to-face experience. So if anybody wants to sit with someone, they come to our offices. Your staff have been very, very involved in the development of this, not only in human services, but Maureen Shop and the adult system of care for mental health services, but your county IT and county telecom departments we've enlisted to sit on a lot of committees with us as we prepared for this. There are also 3 components to the Affordable Care Act. The first one is the Medicaid expansion, which you know is called Medi-Cal in California. That is for those individuals who are not now eligible for Medi-Cal. Medi-Cal today is basically for families with children and persons with disabilities. This now opens it up to single folks or couples without dependent children between 19 and 64, up to 138% of poverty level. And what's very cool for us in implementing this program is some of the simplification. The application is only 3 pages long. For families, it's 6 pages. And a lot of the verifications will be electronic. Right now, if someone comes into our office to apply for Medi-Cal, they usually bring in a wheelbarrow full of all their verifications that we need on their address, their income, a lot of their expenses. How this will operate, if it operates as planned, is our staff, your staff, will sit at the computer, take the application, and we should be able to press a button to a federal hub that will go to the IRS, the Franchise Tax Board, EDD, to verify what someone has told us their income is, to Homeland Security to verify citizenship status, and to Social Security to verify Social Security number. It's supposed to be real time and come right back to us and say, yep, what Cheryl Davis said is accurate, go ahead and approve for health care coverage. Because there are so many uninsured folks across the nation, we are now being told it may take anywhere from 4 hours to 24 hours to get that turnaround time, at least initially. 100% of the medical services for the Medi-Cal expansion will be those 2 health plans, provided by those 2 health plans under our managed care. Applications and ongoing service is us. This is Human Services' role in the Affordable Care Act in California. We also will have our existing low-income health program that you approved, which we call MCE, Medicaid Coverage Expansion. Those folks will transition over to this expansion come January 1. Right now we have about 3,100 beneficiaries. As you know, there's also a fiscal component to that, and the governor has made his proposals in the May revise, and you will be briefed on the whole fiscal policy aspect of that over the next few weeks. Our existing Medi-Cal program continues as is, but in the old-fashioned way. Folks will still have to bring in all the paper verifications. We're hoping to move the state to more electronic verification on this program too, but we figure that'll probably be around 2016. The second component of Cover California is the advanced premium tax credits. This is also for individuals and families of higher incomes, 139% to 400% of poverty level. No income or no age limitations on this. This coverage is purchased through the exchange, and the exchange call center will provide all of the services to this group. Human Services will only have a role in this if the person who wants the face-to-face service comes to us. So we, in addition to knowing all of our Medi-Cal programs, will have to know the advanced premium tax credit just in case someone does walk in. Again, same simplified application, same verification to that federal hub, but folks in the advanced premium tax credits will receive their health care services through the exchange and will have a choice of 5 plans, HealthNet, Kaiser, the usual health plans, and they get to choose what premium they want to pay, what level of service, what share of cost. It's a very in-depth analysis, much like us as employees get to choose, that the families who will end up applying for this program will go through. What they will receive is a tax credit. They can either true up at tax time in March and April and either get back a nice refund check or maybe not have to pay as much, or if a family says, I cannot wait until March or April for that, they can ask for the subsidy each month along. So if the family was going to get a $1,200 tax credit, it would amount to a $100 subsidy a month that would be paid to their health plan. Again, they will be able to apply through the California or Cover California call center, or online, or by mail there, and walk in with us. These are the income levels, just to give you a sense, because when we talk about federal poverty level, folks don't always know what we mean, but it can go up to, a family of 4 can make up to $94,000 at 400% of poverty level. What happens is a sliding scale approach to this. Lower income folks will have higher tax credits or subsidies, or lower income folks will have higher tax, I'm not saying that right. Lower income folks will have higher subsidies and tax credit, and the higher income folks will get the lower subsidies. And then the third component of Cover California and the Affordable Care Act is called SHOP, Small Business Health Insurance Program. And right now it's only open to small businesses who have less than 50 employees. In 2015, the Cover California will open it to those employers who have 51 or more. And it's full-time employees, and full-time is defined as 30 hours a week. Businesses who have less than 50 employees are not in the mandated group. It's if you have 51 employees or more, there's a mandate to have the coverage, and then the fiscal penalty can apply there. Again, this is designed to be a large insurance marketplace for the small businesses so that they can get some of the cost sharing, the reduced premiums that a large employer can get that a small business doesn't get on their own. They would apply through a private sector insurance broker, and Covered California, or the exchange, just awarded that to Pinnacle out of Southern California. So a small business can go through the Covered California call center, but they would be referred then to Pinnacle. There are tax credits available, 35% this year, 50% next year for these small businesses on the amount the employer pays on the premium. This is how it works. So an uninsured person in Placer County can apply online, by phone, through the mail, or fax. The hub is Covered California. Everything goes to them. To the left, if that person is determined through an initial screening that they would be eligible for Medi-Cal and that we should be working with them, they are sent to us. The expectation is it would be a warm handoff, that they would call and not just drop the call into our call center, that we actually answer. The expectation is that we answer 80% of our calls in 30 seconds. Right now, our standard is 80% in 60 seconds. Right now, our average speed to answer is 32 seconds, so we know we can make it. But our position to the state is we can do 30 seconds if you're willing to pay for us to do 30 seconds, because it does involve additional staffing. The industry standard is 60 seconds, but Amazon just dropped to 30, so we think that's where Covered California got it from. And then our expectation is as the caller comes in, that they apply, are determined eligible, and pick their health plan right there on the phone with us. And that's given that that hub works that quickly. So I always include this slide in my presentations in the public just to give a sense of where Placer County is, because we actually lead the state in a lot of social, economic, health indicators. Higher rate of education, higher rate of home ownership, very low rate of children in poverty. Our health indicators are very good. We're behind Marin County. When we're 2, we're behind Marin. When we're 3, we're behind Santa Clara. And then the 1 we're behind 4, that includes Santa Bonita. So what I am trying to say is that we're a healthy and wealthier county. So the task before us in getting our uninsured folks into coverage is not as great as some of our poorer rural partners or our urban areas. But we still have a good amount. We have over 33,000, the estimate is 33,000 uninsured Placer County residents. The projection is that by the time we're done in 2016, that we'll have 75% of those individuals enrolled in insurance. What's highlighted is where they expect to see the movement. You can see we have almost 60% of our residents employer insured, but individuals, you'll see a 13,000 move for individuals buying their own coverage. And then for Medi-Cal, an 11,000 individual move. That will be our job in Human Services, to get those 11,000 enrolled. It's still at the very end. It leaves about 8,400 individuals uninsured. And from other states who've already gone forward with similar programs prior to Affordable Care Act passage, what we're learning from that in the 8,400 are those individuals who just don't want insurance, but a big chunk are what they're calling the young invincibles, young adults in mid-20s to mid-30s who believe they're healthy and don't need insurance, or health insurance premium, car payment, and they'd rather have the car. So what we've been told through a lot of the training we're going through is Human Services, you need to learn how to tweet, you need to learn how to get on Facebook, things like that. But Georgia actually found and made the most significant inroad into the young invincibles. They actually found that if they went to the young adults' mothers and had their mothers make them sign up, that they had the highest rate of sign up. So we'll be tracking on parents too. There is, for that 11,000 in there, the 3,100 we already have on our low-income health program are included in there, so we've made some inroads, and the May revise does include some additional funding for us to be able to bring in those folks. And then we have it broken down by zip code. As you can see, it is across Placer County where we have folks that we'll have to reach out to, educate, and attempt to enroll in health care coverage. And we will be working with our community-based organizations and our faith-based organizations. This morning you approved a Human Services item We applied for and were awarded a grant from Blue Shield so that we could have a staff coordinate that outreach and education. And in July, we'll be bringing back an item for you to consider some funding for our community partners, our faith-based organizations, so they can help us get out through the expanse of Placer County to reach out to folks and help educate them about what their options are. When I'm out in the community talking about this, most folks say, Cheryl, this is great. There'll be health care coverage, but what about having enough doctors for everyone? How are we going to handle, as a state, 2 million more individuals getting coverage? Placer County actually is in better shape than California as a whole. Sacramento also is struggling. The lower number, the better. This says that we have 643 residents for every primary care doctor. This national benchmark is 631. California is way above that. Sacramento's at 814. But even though those numbers look good, if you talk to the doctors, they're saying we're swamped. If you've tried to get an appointment, it's booked out. So there is going to be demand on our health care system. And as Supervisor Montgomery, you know probably better than all of us that that number countywide is very good, but our residents who live east of Auburn to Tahoe have to travel much further to get their primary care. And then this is the Cover California timeline. Outreach and education, that's just kind of getting everybody aware things are coming. But the expectation is that we are out there July 1 through September 30th doing really very pointed, informing education efforts, and then trying to get folks to enroll come October 1. October 1 through March 31 is the first open enrollment period. It's 6 months because there is going to be such a large influx. Then it closes, and for Medi-Cal expansion, folks can apply all year round. For families who are eligible for the tax credits, they have to wait for open enrollment unless they have a special enrollment issue, a life change. They got married, they got divorced, got a job, lost a job, those kinds of things. Then we do it all over again. October 1, 2014 through December is a 3-month period. Every year after that will just be a 3-month open enrollment period. It's just the first year that it's extended. And we figure by December 31, 2014, your human services staff will need their own health care, trying to get through all of this ourselves. Yes. And then lastly, just to let you know, we have been working very hard on this for over the past year. We are working with County Telecom and IT to expand. As you know, Placer is the best human services call center in the state. We're redesigning all of our business processes to deal with the federal hub and getting information flying all over the place. We're coordinating with our local community and faith-based organizations as well as healthcare providers that this is coming. And we've been partnering with your county economic department. We did a joint grant for some outreach and education funding so that we can target employers and employees to get them the best information so they know what's happening. So I always like to end with a little bit of a story, and it kind of goes with what Supervisor Holmes, when you read about that woman and her experience with Health and Human Services. I know there continues to be controversy around health care reform. Our perspective is this is with us, and we're trying to do the best we can for Placer County residents, and there clearly is a need out in the community. We've begun our summer tour of this. We're in demand. We're going to a lot of presentations, and afterwards the stories are very heartwarming or heart-wrenching. And also heartwarming as folks are getting some care, but heart-wrenching about the needs and how healthcare is bankrupting many of our families. Just a couple of months ago, we had a woman come in. The economy has really devastated so many folks, and folks have had to come to us who never thought they would ever step foot in a welfare office. And this woman had lost her job. Her firm, a small business, went out of business a couple years ago, worked there for 22 years. She was an older woman. She was my age. Actually, I should say she was a young woman. And she cobbled together 2 part-time jobs, neither of which had health insurance. And she knew she wasn't feeling well. Finally, she pulled together some money to go back to her doctor, and her doctor said, something's going on. You need to go get some health care coverage. So she came into our Rockland office. The woman lives in Granite Bay, and was very, very anxious about how she would be treated. would her self-esteem be affected? She was having to come in and ask for help and, had a perception of a stinky welfare office where we did not treat folks with dignity. She actually sent an email to us saying that, our staff treated her with compassion and care and helped her through. She got the insurance, went back, had the full workup from her doctor, and then emailed the staff back like 2 weeks later and said her pride had kept her from coming in, and she waited too long, that her cancer was in a terminal state. So I'm hoping at least out of this, that we can try to break down some of that stigma and get folks to the care that they need.
Thank you.
That concludes my presentation. Any questions?
Any questions from the board members? Supervisor?
Congratulations, great presentation, but just a request for, like an update a year out as to the good news and the bad news, just so we have a sort of hands-on perspective of how it all went for you folks.
Most definitely, most definitely. And if you would like us out at any of your community groups, we have a much longer presentation that goes into a little more detail about the health plans that folks are very curious about, that we'd be willing to come to your MACs and any other community organizations. Right now, the faith-based organizations seem to be the ones that are calling us in to talk with their community groups about it. So we've been doing several of those.
Good. Supervisor Montgomery.
Yeah, Cheryl, I want to say thank you. A great presentation, and certainly helpful to me in conjunction with some other reading I've been doing recently. May not need you physically to come out to the MACs, but if there's some kind of handout that we could take out into the communities, to the MACs, coffees, just the other events that the five of us are all out at sort of, on our daily business, that would be really helpful. And then some information on there if people have additional questions on where they can go to follow up. That would be fantastic.
Will do. Cover California has a very neat little website. We can provide that information. And we've been developing scripts for our call center staff to be able to answer those questions too when folks call in.
Thank you.
Thank you. Any other more questions? Well, thank you for that presentation. It was very informative, and you've got a lot of work ahead of you. We wish you Godspeed.
Thank you.
And now, since you're still here, there's some water here. Oh, you got it. We'll move to item 9D, contract, Placer County Office of Education and Child Care Services. Do you need a moment?
No, I'm fine.
Okay.
This is our annual request to you to approve a contract with PCOE for our child care administration. We receive funds from the state, 100% state and federal revenue, to provide child care to our welfare to work families so that they can get jobs and stay employed. We've asked, we provide this money to PCOE because they have the majority of the child care, and by putting it together with our child care, we end up being very efficient administratively. Instead of having duplicate administrations of child care, we use theirs, same providers out there in the community that they use. So, excuse me, we're asking your approval to once again renew this contract with PCOE for over $1.9 million. Their administration is capped at 15% by state regulations on this contract.
Okay. Any questions for Supervisor Weigert? I left your light on? Okay.
Excuse me.
Seeing no questions from board members, what is the...
Move approval? Second.
It's been moved and seconded to approve item 9D, contract to Placer County Office of Education, Child Care Services. All those in favor, please say aye. Aye. Any opposed, any abstentions? Hearing none, motion has moved. Thank you so much.
Great, thank you.
Yeah, let's see, we have a 10:30 timed item, but we will now go to closed session, and we'll be back at 10:30.
The board will now adjourn to closed session to take up the item of existing litigation on the agenda.
reopen the meeting. We have closed session report.
Yes, the board has returned from closed session where they discussed the item of existing litigation, Too Good versus Carlson, and authorize our office to represent the Placer County Animal Services Division in that case. That concludes the closed session report.
All right, thank you. We'll now move to our 10:30 timed item, Community Development Resource Agency Planning, Community Development Block Grant Program Income Reuse Plan.
Thank you, Mr. Chair. Michael Johnson with the Community Development Resource Agency. Staff is asking that the board conduct a public hearing today to consider an update to the county's Community Development Block Grant and Program Income Reuse Plan. As the board is aware, the county receives funds from the Community Development Block Grants. Some of those funds were utilized this morning for the Sheridan Water Improvement Plan that's before the board. From monies that we lend out through the CDBG program, when those monies come back in, the county has the ability to reuse those for a variety of uses. Back in September of 2012, the state updated its policies for the reuse of those monies. This action today is to bring the county's policies and programs in line and consistent with the state standards for the reuse of CDBG monies. To comply with this update, staff is requesting that the board conduct a public hearing this morning and then adopt the ordinance that's set forth in your board packet. Staff is available to respond to any questions the board may have.
I'll open up the public hearing and entertain any questions from board members. Seeing none, is there anyone present that wishes to address the board on this item? Seeing none, we'll close the public hearing, bring it back to the board.
I move we adopt a resolution authorizing an update to the Placer County Community Development Block Grant Program Income Reuse Plan.
It's moved and seconded to approve item 5, Community Development Resource Agency, Community Development Block Grant Program Income Reuse Plan. All those in favor, please say aye. Aye. Any opposed? Any abstentions? Hearing none, the item has moved. And now we will move to our 10:40 timed item, Community Development Resource Agency, Placer County Targeted General Plan Amendment. Mr. Clark.
Morning, Chairman Holmes, member of the board, Lauren Clark with the Community Development Resource Agency, and to my right, Christopher Schmidt from the Planning Services Division of the agency. And here today bringing to the board's attention, or actually for the board's decision, an update to the general plan, the 1994 general plan policy document in particular. As just background, what I wanted to point out was that this particular update is to the countywide general plan policy document. So over the years, since 1994, the board has seen a number of community plans come forward. You've seen the housing element come forward. You've seen changes to the transportation diagram when we added Placer Parkway and Highway 65 bypass. But this is really an update to the policy document that affects all of the unincorporated of Placer County above and beyond what we've done, both in the recent past as well as where we might go in the very near future. For a little bit of background, the county first adopted a general plan in 1967. Since then, we've adopted a series of community plans, around 20 or so over the years. In 1987, you adopted an agricultural element to the general plan that was superseded in 1994 when this document was updated. Since 1994, you've had a whole series of community plan updates, as well as you began to implement the Placer Legacy Program in 1998-2000. From that led to the preparation of the Placer County Conservation Plan, which is actually an implementation program to our general plan. And we look forward to a comprehensive update to the general plan in the not-too-distant future. In terms of the timing of this, because the general plan has been relatively static since 1994, we felt it was necessary to go through the document, ensure that it's internally consistent with our, not only our other community plans, but our land use codes and ordinances, to make sure that all the tables and charts and figures are up to date, which they were not, and to revisit the policy in the context of is our policy current and contemporary and internally consistent, but not necessarily new policy that would take us into new land development standards. State law does require that we have 7 elements to our general plan. We actually have gone beyond that. We organize around chapters, but we contain all the necessary components of those general plan elements. We also have areas related to agricultural and forestry resources, cultural resources, and public facilities.
The public facilities component in particular has been very important to this county as we've looked at choices that we're making around urban and suburban development in the unincorporated areas. In terms of this particular update, which has sort of been coined a targeted update, it really is just edits and corrections, a lot of status and updates to things, existing programs that needed to be updated, new programs that have come to the county that we needed to incorporate, and very limited new programs. But in general, there's been no land use updates. We've left the land use diagram alone, other than to make sure that it is up to date. So the city of Roseville, for example, has grown to areas of the west. That changed a very important figure that we know is the future study area. That figure was out of date. Highway facilities have changed. They've moved to some degree. Community plan work that has informed things that we have done in the general plan has caused changes. So all of that was reconciled with this particular update. We have not changed any capital improvement program. We have not changed any land use that wasn't previously heard by the board, and we have not changed any land use designations. In terms of where we go from here, one of our objectives is to get the Placer County Conservation Plan done first, before we come back to the board with a comprehensive update that would touch on land use. So in many respects, the PCCP is sorting through issues of the geography of land use versus conservation, particularly in western Placer County. Once that is sorted out, we believe there will be an overlap between the work programs. Then we will start to move forward on a comprehensive update beyond the limited scope of this effort, and we will also bring new issues to the board, issues that heretofore haven't come to the board, namely related to climate action plans, Assembly Bill 32, and Senate Bill 375. And then obviously the CEQA document that will have to accompany that, which we would anticipate would be an environmental impact report. In terms of the key elements of this particular update, a lot of antiquated code references. We had references to a zoning code in the Tahoe area that has been out of our zoning ordinance since 1995, the old TR1, TR2, 3, and 4. Things like that, simple, obvious cleanups that had to take place. There is new legislation known as the Complete Streets Act that we needed to carry forward into our policy document, some work related to best management practices. And one of the more important ones is the county's hazard mitigation plan. We needed to incorporate references to that, which would allow us to qualify for federal funding in the event there was a disaster in Placer County. Without having that in our general plan, we would not necessarily qualify for those funds. The biggest area of change in terms of what you see inside the document, sort of an underlined strikeout, is incorporation of the 2009 housing element. So while it appears to be a significant change to the document, it is something that the board has already approved, is already adopted in its current policy that's in place today. We are moving forward with a 2013 update to the housing element. So the one that's in the general plan that you see today will be replaced by the 2013 document. It's at the state right now, HCD, for review. In fact, we have a conference call this week with HCD, and we anticipate that that will come back to the board in September of 2013 for final adoption, and then that would replace the 2009 version that we are bringing to you today. So overall, we do recommend that the board first consider the environmental document that was prepared for this, which is a negative declaration. We also recommend that the board adopt the resolution, which is attached to this, which will amend the general plan. And I need to point out that the Planning Commission did consider this item in April, and on a 6-0 vote, Commissioner Sevison was absent, but the Planning Commission did recommend that the board consider this today and consider it favorably. With that, I am here, and Christopher Schmidt is here to answer any questions that you might have regarding this important item. Thank you.
Thank you. On that, I'll open up the public hearing. Any comments from board members, questions? Seeing none, is there anyone present that wishes to address this item? Seeing none, we'll bring it back to the board.
Move approval that we adopt the negative declaration for the targeted general plan update and adopt a resolution amending the Placer County general plan.
Second.
It's been moved and seconded to approve item 6A, Placer County Targeted General Plan Amendment. All those in favor, please say aye.
Aye.
Aye. Any opposed? Any abstentions? Hearing none, the public hearing is closed. Thank you. And now we'll adjourn till our 11 o'clock time. hearing today. And now I'll turn this over to our community item, the 11 o'clock timed item, Community Development Resource Agency, extension of interim ordinance 5704B regarding community centers. Mr. Johnson.
Thank you, Mr. Chair. Michael Johnson with the Community Development Resource Agency. As the board remembers, back on April 9th, the board took action to adopt an interim ordinance to establish a 45-day moratorium on the processing of community center applications. As the board has seen, there has been an increase in the number of applications for community center activities, and the board wanted to take some time to find out what impacts, if any, may be associated with the processing of applications for community centers. Based upon the comments that the public has received, the moratorium was put in place and staff was directed to move forward to develop criteria and standards that may be appropriate for the processing of community center applications. Over the past 45 days, staff has taken an extensive analysis and look at community centers. As part of that analysis, staff compared the standards utilized in Placer County to those utilized in 3 other counties, Amador County, Sonoma County, and Santa Barbara County. On May 9th, a workshop was held before the Planning Commission to address and look at the issue of community centers. There were about 30 people in attendance at that public hearing, or at that workshop, pardon me, and 12 people gave testimony to the Planning Commission. The primary concerns raised by the public dealt with the definition of community centers. The public felt the definition was too broad and needed to be more specific and based on its actual land use. The public also identified concerns and the need for specific standards that should be in place to regulate community centers. The issue of zoning compatibility was a concern to the Planning Commission in its analysis of the issue. When considering zoning text amendments, the Planning Commission recommended that staff look at issues such as parcel size, access from public and private roads, and other standards that may be appropriate to regulate community centers. The Planning Commission also discussed issues associated with code enforcement. The Planning Commission noted that at community centers, most of the events are held on evenings and weekends when code enforcement staff is not available. The Commission concluded that code enforcement would be a very important element for any aspect of community centers that moves forward. The Planning Commission also concluded that staff should analyze the creation of different categories for community centers. This is similar to the various categories that the County of Santa Barbara currently uses. In considering these new definitions, the Commission stated that it was not important to differentiate between profit and not-for-profit facilities, but rather it was more important to identify unique features such as size, acreage, and access and level of intensity for each use. Based upon the staff presentation, the Planning Commission unanimously took action to recommend that the board extend the interim ordinance and direct staff to proceed with the public outreach process for community centers. To date, staff has received approximately 10 comment letters regarding community centers. All of the letters support the continuance of the interim ordinance to allow for a public review process for the preparation of standards for community centers. As outlined in your staff report, staff envisions an expansive public review process for the preparation of any zoning text amendments associated with community centers. Staff anticipates at least 4 presentations before the Planning Commission, and the zoning text amendment will be presented to each of the MACs within the county. The Planning Commission stated that it was pleased with this type and level of public outreach and thought it was appropriate given the public interest in this issue. As stated in your staff report, staff believes it can go through this process and have a proposed zoning text amendment presented back to your board prior to the end of this year. In your staff report, there's a series of options that are available to you. But staff brings forward the Planning Commission's recommendation to extend the interim ordinance for 22 months and 15 days. That's the maximum allowed by state law. In looking at this recommendation, it was county council's opinion that there was value to extending it for the full length, and should any zoning text amendments be adopted prior to that, this interim ordinance can be repealed. Staff is available to respond to any questions that the board may have.
All right, this is a public hearing. I'll open up the public hearing. Any comments from board members? Any questions? Seeing none, those assembled, anyone here wish to address the board on this item? Oh, Marilyn.
Good morning. My name is Marilyn Jasper. I'm speaking on behalf of Sierra Club and Public Interest Coalition. The comprehensive staff report presents the importance of dealing with this problem head-on, resolving it once and for all, with a reasonable, satisfactory solution that all stakeholders can be hopefully happy with. By extending the moratorium, staff time, citizen stakeholder time, and resources will be spent up front. But if the interim ordinance is not extended, staff, county commissions, and citizens will all waste a whole lot more energy having to deal with each and every contentious event center application that comes forward. Without guidelines or a zoning text amendment, we also risk another unfortunate and significant collateral cost, and that is community polarization and neighbor alienation that these controversial proposals often create. So extending the moratorium will provide the necessary time to work out a long-range resolution, hopefully that everybody can live with. If someone has to have events during this 22 months, 15 days or less, they can still have 2 temporary outdoor events, or if a winery, with the winery ordinance, they can have 6 two-day events. That those things will not change. And if anybody wants to hold more events than that, there are over 30 private venues in western Placer County alone, and that's not even counting fairgrounds, parks, hotels, Grange, and veterans halls, most all of which are conveniently situated in appropriate zoning and are available for events 365 days a year. So there's opportunity, even with the moratorium, to have other events in other venues. We urge you to continue the moratorium so that this issue may be resolved. Thank you.
Thank you, Marilyn. Next. Morning.
Morning. Susan Ames. I live at Wise and Gold Hill. You've seen me before. I think you know by now that all of us are really concerned with all the changes that are coming down the pike with no regulations. We were at the Planning Commission meeting and came up with a lot of good ideas. We're more than willing to work hard. The Planning Department came up with really good information, but we just haven't had enough time to put anything in place that's workable. I see no downside to extending the moratorium. You come off looking like a thoughtful and concerned board. We have time to get some regulations in place that will satisfy everyone. It's a win-win. So I think one thing is the definition of community center versus event center. And even the article that came out a few weeks ago in the Bee, after the reporter had been out to Gold Hill Gardens and heard what he was planting, his comment was, I know the community center definition is vague, but he said, I doubt that the founding fathers that wrote it had anything like this in mind. So I think once people get more aware of what's going on, you're going to see a lot of backlash. So I'd like to see it prevented. I'm more than willing to help do that, but we need the time to do it. Thank you.
Thank you. Good morning.
Good morning. Afternoon, I think.
No, it's not yet.
No, morning.
No.
Sorry. I'm Carol Rubin. I live in Newcastle. I'd like to also thank the board for putting this moratorium in place in the first place and just allowing everybody to take a deep breath and look at this issue. And the planning department, who has done a really excellent job, a very thorough job in their staff report, and the planning commission for their thoughtful consideration. I'd like to also echo what Ms. Jasper was alluding to this present process, the way that wineries are regulated differently from everybody else and community centers have pretty much no regulations at all, is really a mess and wastes everybody's time. And what we need is we need to have some common sense guidelines in place that make everybody know from the beginning what is good and what's not allowed. And this moratorium, continuing it, will allow us to put those guidelines in place. I'd also like to encourage the planning department and the board and those of us who are involved in this to kind of step back. I think there's a larger issue here. That, yes, the sections of the code that deal with community centers and with wineries really do need some revision. But I think our basic question that we're asking is under what conditions, if at all, should businesses be permitted to host large, frequently occurring gatherings in Placer County ag zoning? It has nothing to do with what kind of facility it is or how closely it's related with agriculture. Let's look at the basic regulations that Mr. Johnson has alluded to: size, frequency, access, and whether this is really good for Placer County as a whole. I just want to remind you, if you're going to try and sell agritourism, you have to make sure that we don't kill this goose that's laying all those nice agritourism eggs. We got to have some ag for the tourism to work. And I want to thank you again.
Thank you, Carol. Morning.
For once, I may be able to be brief because Marilyn and Carol covered it all, but basically I'd like to please urge you to extend this moratorium because I was so excited about the work we did with in the workshop and with George and with the director on the this was fabulous. This was a need that I think is clear to all of us. I don't think any of us in the previous applications have been happy. I think the applicants are disgruntled. I think the neighbors are disgruntled. I don't think it was a win-win. The applicants, out of your own mouths, Supervisor Duran and Oler were saying, my goodness, 2.5 years to get this thing squared away for Gold Hill Gardens, and to this day it seems still as though it's not harmonious with the area, despite your closing comments last time. And so right now, I think we can all agree it's broken now. It's not serving us. It's not serving us just based on the amount of time and inefficiency and vagueness that it has. And none of us are here to say absolutely none of anything. All of us are here to work out a solution that we can agree upon and move forward and not need to monitor individually by attending public hearings, and that we can, and people joining the area will know what they're signing on for, because this right now is so open-ended, it's just not serving the county, it's not serving the planning commission, it's not serving the applicants, nobody. So that's clear. We need to do this work. And I would urge you to give us the other 45 days to do it so that we can make it really strong. There's good investigations been going on with checking in on other counties. We don't have to reinvent the wheel here. We can lean on some of these things and say, what is the model we want? And I want to underscore what Carol said, because I think our Director Johnson did a fabulous job of sort of summarizing how we got where we are and where we are now. But I wasn't, unless I missed it, I wasn't really hearing a repeated voice from the public that came up during the last workshop, and that was, can we please back up and take a look at the intent of the farm agricultural zoning, which is the purpose is for agriculture as supporting agricultural operations and then low-density residential, and see what is appropriate in that zoning. So it's not this, we're just looking at, I think we've almost gotten too fragmented in trying to divide up between community center and event center and winery and stuff. Let's back up and ask ourselves. And then some interesting points were brought up in our workshop about the wineries almost feeling penalized at this point. And that's why they're applying for community center applications, is because they're a lot freer license in the community center application. They're just using it as an end run, and they've admitted to me. I mean, I spoke with the winery guys. I like them, and they've admitted to me they're using this as an end run to the winery ordinance. So they both need work. The winery ordinance needs some work. The community center definition definitely needs some work. So I please urge you to extend this moratorium such that it would allow us to do the work necessary before any other egregious, ill thought through mistakes are made.
Thank you. Whoa, right on time. Anyone else wish to address the board under this public hearing? Seeing none, I'll close the public hearing and bring it back to the board. Comments, questions? Oh, Supervisor Wagner.
I move that we adopt Planning Commission's recommendation, which essentially has been discussed, includes a 22-month and 15-day extension of the ordinance regarding the prohibition, or whatever the appropriate term is for not hearing any new applications. Moratorium, thank you. And the proposed work plan schedule is delineated in the staff report that culminates with a lot of public outreach at the Planning Commission.
Second.
It's moved and seconded to adopt the ordinance extending the interim ordinance 5704B. All those in favor, please say aye. Aye. Is there any opposed? Any abstentions? The motion is moved. Thank you. And that concludes the business of the board. Is that correct, Council? All right. We are adjourned.